Well, you have to think about this in three ways. And we've had 6 other governors sign up, including the head of the National Governors Association, Brian Sandoval, who happens to be a Republican. Look, there's 3 ways. First of all, you have to stabilize the markets because things are in a frenzy and the markets could melt down, which means that millions of Americans would lose health insurance. So think of it this way. The car is in the ditch, and we need to get it out of the ditch and stabilize the situation, which is exactly what we do here. But secondly, we then give states the ability to bring any type of innovation they want, as long as they're not dropping coverage for people and as long as the coverage is going to be reasonable, where people are going to have comprehensive coverage. Let me give you an example of what I mean. You're 25 years old. We're going to give you catastrophic coverage. We're going to give you a health savings account. And we're also going to make sure you get primary care. That's comprehensive, okay? That is a definition of comprehensive. And so what we're going to do with this is we're then going to let the states be able to innovate dramatically within certain guidelines, but they'll have much power. And then thirdly is what John was just talking about, the ability to begin to pay now for performance, not for quantity, but quality medicine. So initially, stabilize the insurance market so it doesn't collapse. Secondly, let the states have the ability to innovate dramatically and to be able to make sure that we can make sure people have coverage, that they don't lose what they need. And then finally, change the whole way in which we think about health care. This should satisfy about everybody because, look, if you're a Democrat and you want to double down on Obamacare, you can. And if you're a Republican and you want to design your own plan within certain guidelines, because we don't want people dropping folks from coverage, you can do it. And I'm excited about the possibility of having the responsibility to design a plan that fits us, just like all the other 49 states can do. So I think this goes right down the middle. And I want to tell you, John Hickenlooper's, he's terrific. His staff has been terrific. Our staff has worked well together. And we think we have a document that is absolutely a framework for how to get through this mess and move on.